For the next part of the meeting, we thought it would be great if we could reflect on the past year. And we invited here 4 outstanding cancer nurses from across Europe. I want to ask you, how was the nursing community informed in your country about COVID-19 pandemic and how it all started?
Things started a little bit crazy and confusing, but I think it was for everyone. I think the misinformation scared a lot of actually human resources. I think that was the main impact in oncology. We were struck with a lot of deficiencies in human resources because of COVID-19. The information got a little bit stronger. We knew that our patients were more sensitive and more frail to the disease.
That was really what happened. The lack of information was tremendous. We didn't know anything about the virus. We equipped in the oncology day unit, for example, with gowns and masks and glasses and everything like we were treating COVID patients, and no one knew anything, and the patients were very, very scared. Some of them didn't want to go to the hospital to get their chemotherapy, for example. So the beginning was really hard regarding the lack of information.
Where I work, it was available, all the PPEs special for COVID. We had the COVID kit for to work with any patients. We got a training for donning and doffing, but in general in Palestine, it was horrible. The status was very, very difficult in other hospitals. The healthcare providers did not have M3 or N95 masks. They did not have COVID kits. They only had normal face masks, sometimes face shields. Sometimes they do not have hand sanitizer, even the normal gloves. Some hospitals get used to work with kitchen gloves, the one with clear. Yeah, it was a horrible situation in other hospitals.
I can imagine that you have to make hard decisions. So I want to ask you, and if you want to share, what was the hardest thing you encountered during cancer nursing during this pandemic?
One was stopping cancer patients' treatment when they were responding, and actually having them plead with you over the telephone, because we were very rarely allowed to see them face to face, and they'd plead with you. And these are often young cancer patients as well, that would plead with you to continue with their treatment, but we weren't allowed to because the rules didn't allow us to at the time. So that was hard. Breaking bad news over the telephone about scans, cancer patients' cancer having progressed is something I never ever wish to do again in my career. That was absolutely horrendous, because they'd be on loudspeaker with their loved ones, and one of the things I think is core to our profession is the way that we communicate and interact with cancer patients. And over the telephone, that's not the way to do these things at all. But as was the rules at the time, we couldn't do that. And I would never, ever wish to do that again. I think the other thing was seeing funeral processions come through the hospital of my friends that died from COVID. I lost 2 close colleagues, and actually seeing their cortege come through the hospital grounds was horrendous. And again, things are much better now, so I want to try and focus on how things are getting better now, but I don't forget that, and I don't think I ever will.
But also, Tamer, what were the hardest things you had to do in your practice?
Here in Palestine, we live in 2 separated towns, which is West Bank and Gaza. Gaza is really separated from us, and all the patients from Gaza, they were really separated. And we couldn't even transport the medication for these patients. And I really faced, it was very hard for me. I was trying to help the patients in Gaza, but it was difficult due to the lockdown. Any patient who wanted to enter Gaza, he has to enter isolation room for 21 days. That was the situation. That was a protocol in Gaza, so that the patient decided to not come to receive their treatment. There was a huge treatment delay. Some patients came back with metastatic disease after they did the operation, and it was it was very hard for the patients.
It was exhausting, and for myself, for my colleagues, I have one colleague, for example, that got alopecia due to stress, and psychologically, yes, because we were afraid of getting infected, because we had no nurses, so we lived with the anxiety of, if something happened to us, we couldn't go to work, and there were not enough people to do what was needed to be done. So yeah, it was very hard.
I think that 3-week period, 1 month, destroy us in terms of motivation mentally, because we were not being able to do what we were supposed to do. And we tried to have oncology patients came to us because we had the beds and the skills and the team, but it wasn't possible, like for bureaucratic and referential matters. And we tried to get out. So we told them, so please lend us to some other hospital. And we actually found that hospital that wanted us, and they didn't let us. So it was probably for me the most difficult time in this pandemic, and for my team also. We were very, 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 very low morale in that time because of that, because we weren't helping in specific terms in our full capacity skills for oncology or COVID.